Thank you for having me. I would like to thank the ILC committee, Sandy and Susan's, for being here. It's my pleasure to be here. Today we're going to talk about tools and supports for living with EDS. So I have no conflict or of interest that exists with this presentation. So the overarching aim of this talk is to explore psychological interventions and tools that can better support patients with EDS and their families. I'm not going to go into what EDS is because I think by now you guys all know what EDS is, that it's a connective tissue disorder in the body. There's many challenges living with EDS. I have the pleasure of working with a diverse population of patients and those with EDS. And here are some of the main challenges that arise. Medical, as we know, there's fatigue and there's migraines, chronic pain, hypermobility, joints, dislocations, fast heart rate, heart valve problems, osteoarthritis, gastro problems, stretching and thin skin, delayed pore healing, and ruptures. I also broke it down into there's a lot of psychological and emotional challenges that we've seen in the literature and other speakers have discussed already, and that's anxiety, depression, stress disorder, affective disorder, low self-confidence, esteem, negative thinking, and hopelessness. Lastly, I do see a lot of quality of life changes and challenges that happen with those who are diagnosed with EDS, and that's isolation, absence from work and or school, and cannot keep to schedule or plans that they want to. So if you look at all three of those modalities into one, it's very complex and challenging, isn't it? So that's why I'm here today to talk about what we can do. So there's no doubt in my mind that EDS is a complex disorder. And I got some of these random facts that a lot of my patients who told me on Pinterest that they went onto and that they identify with. And here's one, that random fact number one, that Ehlers-Danlos syndrome is a group of inherited disorders that affect our skin, joints, blood vessels, walls, and pretty much all of our body structure, yet we all look completely normal. Right? Those that you know me know that I have Ehlers-Danlos syndrome. And when I'm walking, passing others, who knows who you're passing on the street? You have no idea who has EDS. Another random fact is that EDS is, to some extent, an invisible condition. Still, we used a lot of energy and effort to do things that we feel natural to others. Sometimes that healthy young person taking the reserved seat on the subway does definitely need it, right? And what do? The only time people will address that I have EDS is that if I dislocated my shoulder or my knees and I'm bracing, or on my fingers. But other than that, you can't tell. People with EDS, hypermobility syndrome, sometimes are labeled as lazy, hypochondriacs, because doing everyday tasks and activities may cause pain. I have a lot of patients coming to me and saying, well, you know, even my own family members, my extended family members who don't know, think I'm lazy, but it's just I can't do it. Not everyone looks sick, and because of this, friends, colleagues, and even some doctors can be unsympathetic about, the understanding of EDS, so it's very hard. This can mean that people with EDS can spend years searching for a cause of their symptoms and pain because the medical professionals are somewhat unfamiliar, but thankfully, conferences like this and having more doctors involved, we're getting to a better understanding. And sometimes it leads to a misdiagnosis, that a lot of patients that come to me seem they've been misdiagnosed for years. I know that for me, when I was going through the process, I'm actually a Quebecois, and when I was in Quebec and having some symptomologies, I went through the whole the test, and I started off thinking that, wow, they thought I had Marfan's, right? Until I came here and got properly diagnosed. There's also testing has proven that those of us with hypermobility type, such as me, do not respond to local anesthesia. We feel it all, but we're often dismissed as hysterics. Like to say, we hate going to the dentist. I know it's a challenge for myself and other doctors of disclosing, how do we communicate our diagnosis? How can we let others understand about EDS? It first starts within, right? It first starts with educating yourself. When we start developing symptoms, most of our tests come back as normal, right? I don't know about you, but there's times where, self-disclosure here, where I was tested one day, I'm tested for lupus and positively, and the next day I'm fine. So depending on, the time of day, how you're feeling, stress, you're going to have different reads. And, thinking that it's all in your head and finding out, wow, I have a diagnosis and it's called EDS and we're not crazy, and awareness of all the rare conditions is definitely crucial. Lastly, we know that EDS is painful. I admire those that come today and have been sitting for all this time. It's like I could tell when everybody is here and we're doing adjustments. Right? I've seen it, I'm doing it, and I'm looking at someone and I'm just like, I got ya. I understand where you're coming from, right? So your joints hurt because of how unstable they are. You have micro tears, minor subluxations, mild demyelination. Your muscles are working twice as hard to make up for your unstable joints and so on. And most of us live with daily pain. And that's sometimes between the scale of 5 to 10 on a pain scale. Now, I don't know about you, coming from a very athletic background, I thought this is the way to live, right? This is what we're supposed to be feeling, and this is my normal. So how do we manage EDS? The management of EDS includes treatment of acute emergency manifestations, reduce of chronic symptoms, as well as primary and secondary prevention of acute and chronic complications. So the first thing is emergency room. What if patients with Ehlers-Danlos syndrome show up in emergency? What would doctors think the differential diagnosis would be? What would be the presenting issues? True story, emergencies are my secondary home. And I remember I had to do something. I remember saying that because I'm hearing my patients saying, oh, I have to go to emergency. Such fear and anxiety came. This was 2 years ago. I went to Emerge, and the first thing I said, I have EDS, and the nurse at the emergency room said, can you please spell that? So I just went slower, and I said EDS. Right? And here I am with a dislocated of my hip, a dislocation of my hip, and I'm thinking, wait, I'm in pain here. And how do I diagnose what medication I'm in? And then she's asking me to spell it again. Then, no joke of a lie, I go a year after that, I said I have EDS, and they're like, okay, I think I know what that is. I saw that they were on Google and went to Wikipedia on the computer. A little bit nerve-wracking. And then another doctor of Emerge comes back and he goes, okay, so I heard you dislocated something. And I said, yes, I did. And he goes, okay, and I see that it says here that you have Down syndrome. And I just put my head down and I said, I was kind of frantic at this point because I thought, you're caring for me. And he actually presented me, he goes, okay, Dr. Danielle, I see that you have Down syndrome. And I said, well, the correlation of that doesn't really, I work with individuals with intellectual disabilities, and there's not one that I know that went such far in their medical field. So, I just said, sure. I just wanted medication at that point because I wanted my IV drip to start. So, that was a bit harsh. And then they think, well, why is she asking for this medication? Is there an addiction? Right? I know everybody's nodding, those who are familiar with that. So, pain scale, that's where we start. Okay, so right here is all the, there's just different descriptives. I say for patients that are at 8, intense to unstable to move, go to the Emerge. Definitely go to the Emerge. But then I broke it down and said, okay, well, this is an everyday pain scale. What about an EDS pain scale? What would that look like? When would I go to Emerge? Because I'm living with it. And I got to say, I work 6 days a week and I am always on the go. Sometimes I don't know that something is dislocated. That's how high my pain threshold until someone says, Well, unless you have a shoulder pad on the right-hand side, you're a little bit lopsided. And that's when I'm like, right? So when to know? Well, this is where I would say for most individuals is like in the 7 to 10 range, really. This is when our pain is heightened above the usual. Here's the pain may be apparent to others, but still easily hidden with a smile. Right? That's when you go. And now I had the luxury to work in the Good to Go program at Sick Kids Hospital. And I worked there for a year. And I developed a MyHealth Passport for myself. And I don't know if everybody knows what a MyHealth Passport is, but I'm going to give this here, and everybody can take one. Just pass it along. Here's a resource that it's a wallet-sized card that lists a personal medical condition, past procedures and treatments, medications, allergies, and other health-related information. And so it's portable, it's customized, it looks like this, it's wallet-sized, it's created by adolescents at Sick Kids Hospital who have similar disorders. It's the goals is patient education, ownership of your own health and information, communication of important information, and it can be used without having to buy or download anything. It is free on the internet, and there's the link for it. So I wasn't sure if the link would have been active, so I did a snapshot of everything, and I showed it, and I'll give you guys a few models to pass around as well. So basically what you do is you click on it, and you're going to see this first link. I'm sorry it's so small, but if you go into the link, it will say MyHealth Passport, okay? And then from there, what you do is they're going to ask you for a bit of information for stats purposes, who's using the site. And this stuff won't be saved to the passport because, as I said, it's literally this small. And then you go into another link, and then it says, this is where you put in all your health information. Much of it you'll know, and if you don't know, it'll be really easy to gain from your doctors that are there. And then instead of putting none or NA, just skip it. So you could skip a lot of it. Okay, and then it's going to ask for information. What is your diagnosis? What medication are you on? Who's the doctors involved? Okay, it even says exercise, and on it I wrote ha ha ha. I did that for humor for the doctors. I actually carry one of those with me. So now when I go to the emergency room, I just give them the MyHealth Passport. It's very simple. I don't get frustrated. They know how to spell it, right? There's no misdiagnosis on my file. So that's something that I utilize and I use all the time when I'm there. And you could carry it around. Helpful tips for MyHealth Passport is that use the generic passport when it's there. There's a lot of room to add information, the special needs section and others. There isn't one yet for EDS. There's one for sickle cell and other genetic syndromes, but I want one for EDS. I talked to the nurse practitioner there, as well as the lead of psychology there, as well as occupational therapists to get that going. So I'm really excited about that. Don't put everything on it. Think about what you want a stranger to know in 2 to 3 minutes if you could speak for yourself in that time, okay? Be advocates for yourself. Put the really important information, you'll see it as you go along on the example, in all caps and highlights. And highlight it with a marker after you print it. For example, high risk of dislocation at Mount Sinai Hospital and Toronto General Hospital, right? So you know where you're going. Make sure that it's highlighted. It's very, very important. And laminated. As you can see, the ones that I did there, I did those 2 weeks ago with one of the OT at Sick Kids Hospital. And lamination, why? Because, you know, you don't want it to be damaged, and you never know when something's going to happen. So I also talk about how do I use my MyHealth 3-sentence summary. This is, you know, things that they always ask you when you go into the ER. And one thing is, or how to communicate your diagnosis is my age, my diagnosis and brief medical history, my treatment plan, and my question concern to talk about during the visit. So this is either when I go to the merge or after for follow-up, because, you know, a lot of times it's like, now that you're done that, I want to see you again. What is it that you want to get from this, right? You never know who's in front of you, who's on call. So I'm going to show you a picture of my husband right here. You may know him, Leonardo DiCaprio. So I am I'm 16, I'm not, but you know. I'm 16 and I have Ehlers-Danlos syndrome type 3. I was diagnosed only 6 months ago. I have chronic pain and subluxed and dislocated easily. Sentence 2 is I have only been taking extra strength Tylenol and Advil. And 3, I am here today because I would like to review my pain medication. Very simple. Have those 3 sentences written down. Everything that I'm showing you, even as a mental health clinician, is things that I practice, and I know it works. It lowers your frustration level, lowers your anxiety level, and it's helping you to learn how to communicate a diagnosis that is so rare that we're still learning about. It's very, very important. And as we're learning about it, and as there's newfound research, you know, we have to develop our skills in learning how to communicate. So self-care, very, very important. As I said, in the mental health, we know that there's 3 main areas associated with people with EDS, and that's stress, depression, anxiety. And then we have here, it enhances pro-inflammatory substances. And how that affects the immune responses to infection and injury. This means that if you choose to ignore mental stress, it's a really big part of it in self-care, but if you choose to ignore mental stress in your life, you may never be able to physically heal from pain, strain, or injuries, as we learned in some of the other talks, so it's very, very important. This is some of the self-care emotional health, is maintain a sense of normalcy. You know, through my journey, I really focus on the things that what I can't do, but the things I still can do. And there is a shift in just how I explain it, but it makes such a huge impact. Mourn the things you can't, but do the things you can. Promote activity, walking, swimming, and stretching. Meditate, visualization. We've seen this, and there's a reason why these words keep on coming up through all the talks, because it's documented, it's research, and it actually does work. Write a journal. Talk therapy. That could be CBT. I'm trained in cognitive behavioral therapy. I use it. I even use it on myself. It's very effective. Don't compare your life to others. Everybody is different from the beginning. Even prior to your diagnosis of EDS, everyone is different. Build your relationships, and that means relationships within your community, within your family, and also outside of the community and with the medical team. Educate yourself and others that want to listen to you. Get your rest. You deserve it, most definitely. And find your own spirituality center. And lastly, find a routine that fits you. Mine is not so specific of what you need, because I think everyone's different and everybody's needs are different. So where's the future goals here? Well, I would love to have registered ambulance services and paramedics to the hospital who are specialists who are knowledgeable with EDS on an on-call team. When I was, as I said, I'm a Quebecois in Montreal, we do have this, right? And there's more diagnosis in some of them with EDS. I know some specialties that have this. I guess it's some patients that fought for it that have this, so it's pretty good. Case conference with or without patients to consolidate information from multiple specialties and have opportunity to ask questions, and everyone can be on the same page. And the dissemination of knowledge is definitely key. More so, advocating for yourself. Lastly and foremost, be proactive. In addition to the MyHealth Passport that I sent around, there's also, if you guys seen this is the Ehlers-Danlos Syndrome Foundation. They already have one for you. Okay, so you can laminate it, and it says here, handle with care. I really love that. That's also my wallet. I carry a really large wallet. And at minimum, document the listed diagnosis, common presenting issues for the diagnosis, current specialties, contact details. That will be an ongoing working file. No doubt that, it has been really hard for me when doctors come and say, who have you seen? What have they done? What medications? It seems that now I'm bringing a binder. So if you need to bring a binder, you need to bring your binder, but be advocates and do it for yourself. And of course, seek ongoing support. You can manage your own thoughts and feelings. When you're with your medical team, have your magical question. What brings you here today? As you know, I do that too with my patients. What brings you here today? That's the magical question. Before you go into it, know what you want to do. Don't get sidetracked by, wow, that's rare. Okay? So know why you're going in there. I want imaging in my gut area because something has changed and I have increased pain. Know why you're there. Okay? And that's it. Thank you so much.